Dark spots on the hands of the elderly, what you need to know. Every year we get older, and the older we get the more our appearance changes. And older people do change dramatically. The main features of the elderly are wrinkles and gray hair. But another sign of aging is age spots on the hands. What does it mean? Age spots, or scientifically lentigo, often appear on areas of the body that are open to the sun, the arms, the face of the neck. Due to exposure to the sun, melanin accumulates in the body, which is responsible for skin color. Also, these spots can appear due to hormonal disruptions or from a lack of vitamins in the body. These spots are mostly benign and do not pose a health hazard. They can only cause aesthetic discomfort, because they look really ugly. But if your spots start to darken or bleed, it's worth checking with your doctor. Since age spots are not dangerous, they do not need to be treated. And if you decide to get rid of them, after a while they appear again. And to keep these spots as small as possible, try to avoid ultraviolet rays and use sunscreen. Age spots in the elderly. Old age is wisdom, accumulated experience, and another life stage. However, most often old age is associated not with these concepts, but with the aging of the body, diseases, gray hair, wrinkles and pigmentation. But if gray hair and wrinkles can be dealt with the help of beauty salons and modern cosmetic procedures, then what about age spots? Types and causes of pigmentation in old age. Pigmentation in the elderly is a problem that many women and men face after the age of 55. Getting rid of age spots with the help of cosmetics is unlikely to succeed, therefore, before finding another method, it is important to determine their type and find the causes. Senile keratomas. This type of pigmentation is a benign neoplasm and appears as a flat beige-brown plaque. The surface of the keratoma is covered with keratinized epithelium. The localization sites are open areas of the body. The main reason stimulating the development of this type of neoplasm is exposure to ultraviolet radiation. Also, senile keratomas often occur in people with diabetes and obesity. In most cases, keratomas of this type are safe and have a benign nature of education. However, it is important to know that in some cases they can increase in diameter and degenerate into malignant neoplasms. The decision to remove the keratoma is made by the doctor after laboratory and instrumental diagnostics. Flat xanthomas. These are flat multiple or single plaques of light yellow color with a soft consistency. Places of localization: eyelids, face, limbs, torso. The cause of the occurrence is a violation of lipid metabolism, liver disease. Clinicians distinguish several types of xanthoma forms, the most common being localized. Senile lentigo. Senile or senile lentigo is dark brown pigmented spots that appear on exposed skin. The reason that stimulates their formation is a violation of metabolism and hormonal levels. A neoplasm of this type is a precursor of seborrheic keratosis and does not require surgical treatment. In rare cases, exposure to ultraviolet radiation can cause malignancy, so people diagnosed with senile lentigo should avoid prolonged exposure to the sun. How to get rid of age pigmentation. Today, there are several methods of dealing with hyperpigmentation in the elderly: salon, conservative, surgical. The first includes effective cosmetic procedures that help to quickly get rid of benign neoplasms. They are prescribed depending on the testimony of a dermatologist. The conservative method is the use of special ointments and creams that have a brightening effect. When both methods are not effective or are not recommended based on the diagnostic examination, the patient is scheduled for surgery. Chemical peel. Deep chemical peeling is a procedure that can be used to painlessly get rid of pigmentation on the skin of an elderly person. Benign neoplasms are gently affected by fruit or lactic acids, which burn the layer of the epidermis affected by hyperpigmentation. This method is recommended for people of the first phototype, thin light skin, with a large area of localization of age spots. Those who have dark skin should be careful with this procedure, as organic acids simultaneously brighten both age spots and healthy skin areas. Laser resurfacing. This method is one of the most effective and safe. As a result of the procedure, all cells containing melatonin are destroyed. The impact of a laser beam into the deep layers of the dermis is shown even with hyperpigmentation on the eyelids. During the rehabilitation period, the formation of small crusts is possible on the area affected by the laser. 2 or 3 procedures are enough to completely get rid of age spots. Microdermabrasion, diamond peeling. This method is based on deep layer-by-layer resurfacing of the skin with microcrystals, aluminum dioxide, diamond, organic. Microdermabrasion helps to get rid of even large pigment spots. The procedure is carried out with a special apparatus that exfoliates the pigmented layer. The rehabilitation period, severe reddening of the skin, is several days. Phototherapy. Treatment of skin pigmentation with phototherapy is the safest method. It consists in the action of light pulses on a pigmented area of the skin. Since only melanin is susceptible to the pulses emitted by the device, healthy epidermal cells are not damaged. Phototherapy is indicated for people of any age and with any phototype. There is no recovery period, only a slight reddening of the skin is possible for several hours. Surgical treatment of hyperpigmentation is carried out not only by excision of the neoplasm, but also by other modern methods. The most effective, electrocoagulation, radio wave method, RF lifting, cryodestruction. Electrocoagulation. Removal of age spots on the skin with electric current is recommended only in cases where they are benign. The essence of the method lies in the instant excision of pigmented tissues with an electrocoagulator and simultaneous coagulation of the vessels. This contributes to the rapid healing of the wound, the formation of a crust, and prevents the appearance of a scar. Thank you for taking the time to watch our content. If you find our video interesting, please hit the like button and subscribe to our channel for upcoming content. Additionally, we have included some valuable links in the video description below, which we encourage you to check out. We look forward to your continued presence on our channel.